What I've learned from providing this support is that people just want to be listened to, and they want you to tell them, like, that sucks. That absolutely sucks, and that is unfair. And I'm here to virtually hug you as you're melting down, but not offering here's an easy fix. I feel like society gives us the stay positive advice, and people sometimes think they're supposed to be positive, that that's how they're supposed to cope with miscarriage. But positivity doesn't fix fertility issues, and it's hard to process whenever people are telling you to just keep trucking and to keep going.
Miscarriage is common, but many can feel alone and unsupported as they process the loss. Our guest today learned through her own infertility and miscarriage experiences the importance of support and validation as she healed. She went on to create a group of doulas and a support system to help others going through similar circumstances. Here to discuss coping with miscarriage and infertility is Arden Cartrette, the Miscarriage Doula. Arden, welcome to Baby or Bust.
Hi, thanks for having me.
I have followed you for a long time, and I really appreciate a lot of the message that you're putting out there. And quite honestly, your handle, the Miscarriage Doula, I just thought like, oh, I understand that being a doula is, compassion. It's supporting people through pregnancy and kind of after pregnancy. It makes so much sense to have a support person through miscarriage. But I didn't realize it was actually a thing. So can you tell us what a miscarriage doula is?
Miscarriage doula is really a support person for somebody who is going through pregnancy loss at any gestation, whether it's emotional, mental, or physical support through loss. I usually work with people virtually. And so that was something, because I started doing this in 2020, it had to be virtual. So I had to kind of figure out, like, how can people still get miscarriage care? And so I meet virtually on Zoom, and we talk about miscarriage, whether it's me filling them in on what to expect or them telling me about their experience. It's really open, judgment-free conversation about miscarriage and navigating the next steps.
And how do people find you? Is it usually word of mouth or social media?
It started as social media, and then it's become word of mouth, which is the most amazing thing. I also have a podcast where I give people space to share their stories. And so people will maybe get to know my type of support there and then reach out to me. But mainly, I would say social media whenever they're looking for support.
What kind of training goes into being a miscarriage doula?
Training for doulas feels really limited to me. I think that before I was a miscarriage doula, it was mainly referred to as a bereavement doula, which I had still only heard a couple of times. I had my midwife brought it up to me after I gave birth to my living son, which it would have been really helpful while I was pregnant with him. And so a bereavement doula was the first time I had really looked into the coursework of becoming a doula. So depending on the type of doula, specifically birth and postpartum, there are a ton of courses. There are a couple of really great institutions that back those courses, but doulas don't have like a licensing requirement. And so I became a bereavement doula, and that was focused more on second trimester loss and neonatal loss. And that's where I was like, okay, so we need more education on first trimester loss specifically. So I have actually created training for that because it's not out there.
What you're providing is this incredible support.
I usually say to people that it bridges the gap in traditional therapy. And I have a lot of clients who are also in traditional therapy because my support kind of looks like therapy from the outside, but it's really just about them processing or getting validation, because sometimes we don't get that validation unless somebody has been through it. So it's so hard to like pinpoint what it is about being a miscarriage doula, because it is such a unique support for every person. Like, some people want me to listen. Other people are like, can you list out the things I should ask my doctor about and like tell me a boost of confidence? And so it is so unique, which is why it's so hard to pinpoint.
Well, I think that's great. And it's important to make that distinction that it is not therapy. You are not like a licensed psychiatrist or, family therapist. And sometimes people are really intimidated to go to therapy, and there's like a stigma around it. Mm-hmm. So it might be a really great bridge for that support person, but also helping people realize like, hey, if you really truly are depressed, if you really truly have significant anxiety that's impacting your daily life, absolutely your doula can support you, but maybe you should also seek some professional help too. So that's an important distinction.
I've had therapists reach out to me and ask if they could join in on the call and like make a call for their patient, which is so amazing that they are open to getting another person's perspective or help on the part that they maybe don't specialize in, which is a key part to healthcare. If we just like all work together, it'd be easier to support people and care for them.
How did you come to find this path, this calling?
So I had my first miscarriage and felt very alone. And then I started talking about it on the internet and just started sharing my real life experience with loss. And then people naturally would reach out to me and ask me what my experience is like and how they should prepare and what pads they should buy, or should they be getting a narcotic prescription? Is it going to be that bad? And I would walk people through miscarriage. Then I would give my phone number out and literally sit on the phone with people as they miscarried because they didn't know what to do. And so I've been doing this actually for a lot longer than I have professionally. And then when my first son was born, I just was like, I want to do something bigger and I don't know what it is yet. And I kept going back to Sisters in Loss, and they have a great training program, and I kept sitting on it and thinking about it, and then I did it, and I had no idea what I was going to do with it, but then it turned into the Miscarriage Doula.
What is Sisters in Loss?
So Sisters in Loss is a organization. They train doulas. They support. It's mainly support and education around Black maternal medicine. And like the course that I took was a really big highlight on the cultural differences in miscarriage and how we could support Black people through miscarriage and what they're more at risk for and the history and things like that. So I was very specific in doing that course because as a white woman, I didn't know any of that stuff.
I feel like for so long, miscarriage is just sat in shame and things that we just don't talk about. And definitely previous generations have just sort of been like, yep, you just keep going. You don't talk about it. You don't realize how common it is. Like just from my scientific brain and my medical brain, it's like, yeah, human reproduction is very inefficient. That doesn't mean that you can't be sad and seriously grieve loss. But because we don't talk about it and share, then you really think that there's something wrong with you. And it can be very isolating, especially in our present Instagram society where people are putting out this like beautiful family portraits and gorgeous vacations. And you shared reality. You shared like, hey, I actually had a miscarriage and I am okay talking about it.
I try to frame it because I think people feel bad if they don't feel comfortable being open about things like miscarriage. Maybe they don't feel ready to talk about it. Maybe they don't feel like they have the support at home to be open about it and talk about it freely. I like to say that I am so vocal for the people who don't have the opportunity to be vocal. I don't have a job that's I'm scared is going to fire me because of my presence online or the things I talk about being uncomfortable or things like that. I have a husband who's very supportive because he watched me go through miscarriage and was absolutely shocked at what we experienced. And so he is my biggest cheerleader to openly talk about miscarriage. And I had support from my doctors.
What are the different ways that you have seen people process and sort of deal with miscarriage?
I've seen people who they process it out loud. Maybe they start sharing on the internet like I did. We kind of gaslight ourselves into thinking it wasn't a big deal because that's what society is telling us. And so I see people doing that where they think, oh, I had a miscarriage at 6 weeks. It was nothing. My doctor told me that I could get pregnant again right away, and I'm just going to do that. And then if they experience another loss, then they stop and they're like, okay, I'm feeling the heaviness of this. Some people maybe don't process really well, or they don't know where to start, and then they have trouble with friendships and relationships. It really is all across the board. And I think that what I've learned from providing this support is that people just want to be listened to, and they want you to tell them, like, that sucks. That absolutely sucks. And that is unfair. And I'm here to virtually hug you as you're melting down, but not offering here's an easy fix. I feel like society gives us the stay positive advice, and people sometimes think they're supposed to be positive, that that's how they're supposed to cope with miscarriage. But positivity doesn't fix fertility issues. And it's hard to process whenever people are telling you to just keep trucking and to keep going. And sometimes you need to slow down and process.
I get nervous when I see, and I just met with a patient today who's like this, just diagnosed with a miscarriage on a ultrasound at about 7 weeks, no tears, total stone face. Okay, when can I try again? And I know, I mean, she probably went to the car and just like bawled, and we are going to check on her tomorrow. But I just really worry when people are on such an intense self-imposed timeline. There's so many triggers, like even when you have your next positive pregnancy test, you're on pins and needles, or the next time she has to come in for a 7-week ultrasound. I want my patients to build tools to cope. Do you see difficulties in pregnancy after miscarriage?
I will go to my grave saying that pregnancy after miscarriage is by far the hardest thing I have ever been through. I kind of had that mindset at first where I was like, I just have to get pregnant again and this will all be better. You know, I see people think I have to be pregnant by my due date. That will heal this. I won't be in pain if I'm pregnant again. And I have been pregnant on a due date, still just as hard, except for now you're afraid that the child you're pregnant with is going to die as well. And it's it is a completely different ballgame. And I think, so whenever I talk to people and they share with me the moment that they found out that they had a miscarriage, like going back to your patient, if they share that with me, I go back to that moment and I'm like, well, how were you feeling in that moment? Did you feel like you couldn't show emotion? Sometimes it's a partner there and they don't want to freak out their partner because maybe their partner doesn't understand what's going on, or we tend to protect the other person sometimes in a relationship instead of protecting ourselves. And so I noticed that a lot. My husband and I talk about it all the time. When I learned my first pregnancy, a miscarriage, my first thing I said to my husband was, my friend Savannah is going to continue her pregnancy and I'm not pregnant anymore. And my first thought was how my best friend was going to still be pregnant and I had to watch her be pregnant, because I was so afraid of that continuous trigger that's where my mind went, not like, oh my gosh, what do I do now? And so I think when we're in shock, our minds we go into like a fight or flight mode, and everybody is so different there, where some people, they want to fix it right then. I think if it's a first miscarriage, we don't realize that it's not just a moment and it's over. It's a couple of weeks of bleeding and then waiting for a first period and then usually feeling pretty down and not ready to try again. And we don't realize that it's a whole process. But I have people who will break down where a doctor has to have them wait there until they are calm enough to drive home, or calm enough for both them, like as a partnership, to drive home. I have people who just go to the car and let it out. It's so different, and it's kind of crazy how as humans we do react so differently. So it's hard to prepare somebody for what that's like. I'm almost 5 years out from my first miscarriage. I have 2 beautiful living children, and I am triggered by my period every single time. That blood, that trigger never goes away, but I've learned to process it and cope with it and work through it. And I didn't know that 4 or 5 years ago. I didn't think that it would still be bothering me today, to where I literally have to use these tools that I've gathered whenever I see blood. Nobody told me that. I thought if I just had a baby, it would all be fixed, and that's not the truth.
Oh, absolutely. Or when you get pregnant again, you're supposed to be happy the whole time. Pregnancy is bliss. And people don't realize, like, you're just sort of waiting for the other shoe to drop. You're waiting for the bad thing to happen.
Meeting them where they are is key to supporting somebody during pregnancy loss, after pregnancy loss, including pregnancy after loss. If they are really excited, continue that excitement, because they're going to be watching you and how you react to their pregnancy or how you share that news. So I know that my doctor calling me each time with my betas, I would listen to his voice. I'm like, does he sound hopeful or does he sound worried? And I would always pay attention to those things. And I have people in sessions with me who they say, well, my doctor said this and I didn't think about it at the time, but now I'm thinking about it. And they like hang on to those words. And so I feel like as a doctor, like going in and meeting them where they are, it's a great way to support them for sure.
Who should seek out a miscarriage doula? Like, who do you think would benefit from connecting with you?
I think every single person that wants that support would benefit. I am a firm believer that all loss is loss. It doesn't matter if they had a positive pregnancy test and the next day it was negative and they had bleeding and they were confused about what that meant. I will gauge that conversation of how do you feel about that pregnancy? How do you feel about that experience? And so even as early as the next day, if they have a miscarriage, they are still so worthy of that support and that validation. I have clients who are doing IVF maybe after miscarriage, or sometimes people will reach out just for infertility support because they're looking for it. And I have seen a lot of people grieve embryo loss. Like that's a very real thing. And so I am such a firm believer that all gestations matter, all loss matters, all forms of birth, first, second, third trimester, however things happen, everybody is worthy of the specific type of grief support that they're looking for.
If anyone ever tells you that they've had a miscarriage, that one of the worst things that you can say is, oh, well, at least you weren't that far along. Medicine and science has finally caught up with that. So what you're describing by a positive pregnancy test followed by a period, probably a couple days later, or it's a biochemical miscarriage. And what that means is it's just technically it hasn't gotten to the point where you could see anything on ultrasound. So at about 5.5, 6 weeks, you could finally start to see maybe a little gestational sac, et cetera. But biochemical miscarriages matter. You are coming at it from supporting grief and supporting that person and validating, like, you know what? You can grieve just getting a period, whether there was a positive pregnancy test or not. There's another month where you do not have the baby or the family that you're wanting. And I'm coming at it from the doctor's sort of point of view, like, yes, like I want everyone listening to this to know that they can actually take the definition from American Society of Reproductive Medicine. It doesn't mean the doctor's going to listen to you, but then maybe you could talk to someone else.
Absolutely. I've actually, one way that I have supported a lot of people is helping boost their confidence to talk to their doctor because they've been shot down before. And so sometimes what I'll do is I'll say, let's write an email, because that means they can read it and respond on their own time. And maybe that will help out. And it usually does. And I will link to the ASRM's definition. I will link to different articles, and I'm like, just send them these links and see if that helps. And a lot of times it does, because I don't think that people are aware that sometimes those definitions change. And also that those definitions are not law. It's an opinion. It's, what is put out by ASRM. And so just kind of showing that to doctors is sometimes helpful. I feel like with biochemical pregnancies, I see more people getting an answer as to why that's happening than people who are having multiple missed miscarriages. And so that is so worthy of the testing.
The most common cause of miscarriage, of course, is a genetic issue within an embryo that we're not in control of, but no amount of support is going to change genetics in an embryo. But I just feel like there is proof that supporting somebody, validating somebody, being there for someone is hugely important. And most of medicine is not like that. Most of the time you call your primary OBGYN or your family doc and they're like, okay, we'll see you at 10 to 12 weeks. That's the first time we'll see you for an OB visit. And that is absolute agony for someone that's had miscarriages at 6, 7, 8 weeks. And I know that that is the way the system is set up, but it's just that lack of support, I think, is just really difficult. So just maybe being able to talk to somebody during that time is really important.
You've mentioned pregnancy after loss a couple of times, and I see a lot of clients who will come to me and we will talk about their miscarriage experience together. And sometimes they will schedule more sessions as they're trying to conceive. Even after 1 month of trying, having your period is devastating. Like you are already thinking, well, if I'm pregnant this month, my due date will be in this month, then you have all these things you have to grieve now. And so it's definitely trying to conceive, especially after loss, is so difficult. And then in pregnancy after loss, whenever I talk to somebody, I say, let's make a list of things that are going to make you more comfortable in pregnancy, because these are the things that are going to be in your toolbox and that can help you feel better. So whether that's seeing a doctor earlier, getting blood work, knowing what's the different gestations that I can have ultrasounds and what are the benefits of those, going to your doctor with those questions is so helpful, or just giving them that list of, here, this is what will make me feel comfortable. Can you help me?
Yeah.
And finding that support, it's a game changer. And every person I see in pregnancy after loss, if they are unhappy with their medical support, I always advise them to seek different support. Find somebody who fits your needs and will listen and will validate, because it's really important.
It's so hard. There's such a power dynamic, between like the doctor and the patient, unfortunately. And, I have patients are nervous about seeing new doctors, they move away or kind of whatever. And I've had doctor visits like this. The doctor's in a rush. You can tell they're behind. They kind of come in and they're sort of like fluffing through the chart and like, asking kind of questions. And I've told people, I was like, it's okay to just get really vulnerable right then. Mm-hmm. Like it'll stop the conversation. If you're just like, you know what? I'm really nervous about this. Like, or I am feeling a lot of anxiety right now. And I would just love for you to kind of just sit down for a second. Yeah. It literally takes like 10 seconds, 20 seconds, but just kind of sharing how you're feeling. Someone has to be a true psychopath to not like sit down, look you in the eye and say, oh, okay, yeah, I appreciate that you're probably pretty nervous right now. And this is what we're going to do. So like kind of break that sort of just rote kind of doctor-patient relationship. Sometimes that can be helpful. It's really hard to do.
I don't hesitate to tell somebody like, hey, can you please stop and like realize that this is life or death to me, even though it's not to you. And I say it nicely, but not everybody is like that. And I see a lot of people who are like, well, I don't want to bother my doctor. And so they sit in agony for weeks, without an answer to their question. And I remind them that this is their body, their pregnancy, their family building goals. These matter. Like these concerns matter so much. I can't even put into words how much they matter. Go to your doctor and say, I have questions. I have concerns. When can you give me 30 minutes of your time? Like when can I make an appointment that you maybe first time of the day, just kind of meet them where they're at. Like you're saying with the support that you give patients, we can also do that a little bit, but it's hard. Sometimes putting into perspective that this is a doctor's job and they do this every single day. I have this horrible story of my first miscarriage. I called my fertility clinic complaining about pain with intercourse at like 3 weeks after my miscarriage, which I never really got a full answer on, but that's a story for another day. And she called back saying, I got your voicemail about your baby abortion. And I remember after my first miscarriage, that stung me so deep because I took that as her thinking that I went to a fertility clinic, got pregnant, and then elected this. And for me at the time, that was so hurtful that I called her back and I let her have it. and I let her have it on the voicemail because she didn't pick up. And then she called me back and she was in tears apologizing to me. She felt so bad. And she said to me, I, as a nurse, I just went with the medical term and I thought nothing. Like, I am so sorry. It was my first call of the day. I have every excuse to give you, but none of them are good. And I'm just so sorry. And so she actually thanked me for calling her out because it made her more aware in her next phone call.
That is a wonderful person right there.
It meant a lot that she called me back because I don't know if I would have called back. That's really tough to own up to, hey, I messed up. That was a point where I was really vulnerable and sharing that I was really uncomfortable after a miscarriage, and I was just looking for somebody to tell me like, hey, you're recovering, slow down, or this can be normal, or let's bring you in for an ultrasound. And instead I was met with baby abortion. And that was really hurtful at the time. But I think that getting vulnerable was really helpful in that moment with that nurse.
Yeah, that is great. I'm sorry that happened this one time. It was the end of the day. I'd been on call for like 12 days in a row. I was pretty young in my training, and I had to go in and talk to somebody that we just diagnosed with an ectopic pregnancy, right? So a pregnancy in the tube. And it was just so obvious that we needed to do treatment. And I just kind of went in and like zero compassion. I hope I had some, but she, this brave woman just looked at me and said, she's like, stop for a second. Like, you're just telling me that I'm not going to have a baby like 9 months from now. And now you're talking about like surgery and like all these other things. Like, she's just like, stop. And I just like, my shoulders just like slumped. And I was like, oh my God. So this to me is like, yeah, I do this all the time. Right now I'm in an emergency room and this is something that we deal with all the time. But for her, this was like just the worst news that she ever heard. And so, yeah, I have never done that again since. But, I think that we are all human. And I think I'm just so glad that she really taught me a lot.
I think we learn a lot from real life experience. We can only learn so much from our schooling and things like that, that every person that we come in contact with teaches us something. We talked about toxic positivity. And some people find a lot of comfort in those words. Some people are really comforted when people tell them to stay positive. And that's not me, but I will support somebody and meet them there. Like I will be like, yeah, let's think of positive affirmations. And, I'm there to support them how they want to be supported. And so sometimes we learn so much from each individual person. I do have a lot of clients with ectopic pregnancies that we have to process after the fact of those are oftentimes really emergent situations, and the doctor doesn't have time to think of a lot of empathy to have because they're thinking about you being in danger. Exactly. And they're seeing a super dangerous situation because they have seen it so many times before that they know how scary it can be. And so with ectopic pregnancy, I feel like just like a biochemical pregnancy, that's its own unique processing because you also have to process that's really dangerous for the pregnant person.
Oh my gosh, Lora, like it would have taken you 20 seconds to just like hold her hand and say, I am so sorry. I know that you want this baby, you want this pregnancy, and that's just not what's going to happen right now. And then talk about surgery. How can people find you, Arden?
I guess Instagram is probably the best place because it has all my links to everything at the Miscarriage Doula on Instagram. And there you'll find links to my website and all of my offerings.
I do tell my patients how important it is to find mental health support, and emotional wellness is key to all family building. And I have resources and links to therapists in the area, but sometimes people don't need that, exactly what you said. So I'm so happy to have another option for people, and I just really appreciate what you're doing.
I say it's a job I never wanted. I did not envision this for my life at all, but I am sadly happy to be on the other end and listening as people share what they're going through.
I hope you enjoyed that conversation with Arden, the miscarriage doula, as much as I did. If it's the first time that you've heard this term, miscarriage doula, you are not alone. This is relatively new for me as well. And what I appreciate is, as a recurrent miscarriage specialist, as a doctor helping patients through miscarriage, I know how important paying attention to mental health and emotional wellness can be. So whether you're looking at it from my perspective or Arden's perspective, as someone who's had miscarriages herself, needed that support, and is now providing it for others, we can all agree that support through miscarriage and recovery from miscarriage is extremely important. This is not a substitute for a licensed mental health specialist. This is not a substitute for therapy if that's something that you need or is recommended to you, but this is a different option, and it might be something that you want to look into and explore for yourself. I'm your host, Dr. Lora Shahine, and this is Baby or Bust. Baby or Bust is produced by Mark Ramsey, Jamie Solis, and Greg Moga. Executive produced by Paul Anderson and Nick Pinella for Workhouse Media. Baby or Bust is a Mark Ramsey media production.